So yeah, here are the final post-ops. There's the AP, and then you can again see that foraminal decompression more so on the left. Excuse me, the right. And then here is the final lateral.
And how are you choosing the height of your implant? Is it really with the
I
trial, but you're
I
really
measure I measure the adjacent disc space. I measure the operative level, the adjacent level, and I get a sense, of what it wants to be or where it should be, like the last kind of normal height disc. And then I get a feel, right? And so, it's a combination of the two. So I use that preoperative measurement. I use the trial, and when I'm in with the trial, I look at the degree of facet distraction intra-op, and you can see it here. Like, you can see that the 5, 6, and 6, 7 facets do appear a little bit distracted relative to 4, 5, and he did feel that. But by 2 weeks he was doing much better, and by 6 weeks it had pretty much gone. One thing I've done in other patients who have had quite a severe amount of uh, trapezial pain that's persisted beyond 2 weeks. And again, I really don't like opiates. So the two kind of things I've come up with for that is I've given them Valium because oftentimes this bothers the most at nighttime. So I've tried Valium like 5 milligrams, and then a few patients I've actually sent for trigger point injections. And once they got those injections, the pain actually never came back. So I was quite pleased with that result. And so, I'm wondering if any of you guys have had experience trying that, because that's something I want to look at a little bit more closely, because I was actually very pleased with how much that fixed the problem. You know, 3 months they're saying like, yeah, it went away with that injection. They're actually happier with the guy who gave them the trigger points than with me.